The purpose of today's discussion is to address male incontinence. What we are talking about is stress incontinence. Okay? So let me give an overview of our basic plumbing. Okay, side view of the male genital and urinary anatomy. This is the bladder. The bladder has two basic jobs: hold urine and empty urine. That's it. There's a muscle layer that surrounds the outside of the bladder to push the urine out of the body. The prostate is a gland that sits right below the bladder and contains the first part of the drainage tube known as the urethra. As we get older, this gland can enlarge and start to weaken the flow leaving the bladder and make it more difficult to empty. The true sphincter is made up of skeletal muscle that sits right below the prostate and is involved in opening and closing to keep us from leaking. Most of the men that I see that come in with stress incontinence, which is caused by increases in pressure to the bladder resulting in leakage, seen with coughing, sneezing, heavy lifting, most of the time that is caused by a prior prostate-related procedure. Not always, but most of the time. Typically what's happened is either the prostate has been removed for cancer, and then the urethra is sewn back to the bladder, and in the process, the sphincter is weakened. The other possibility that I see quite often is when a man has had the prostate shaved out, what we call a TURP, or what many people refer to as the Roto-Rooter procedure, especially in the presence of prior radiation. This can also result in lack of adequate control. So if a man comes to me and says, "Dr. Terlecki, I'm leaking, I'm having to use pads or pull-ups, what can you do for me?" We want to make sure that they're emptying their bladder well so that they don't have overflow. Make sure it's truly not related to urge incontinence from too much caffeine, poorly controlled diabetes, prior stroke. But if they have true stress incontinence from prior prostate procedures especially, then we want to talk about where they are in their course of recovery, how long it's been since their operation, what they've done to try to reach their maximum recovery, whether that be Kegel exercises or pelvic floor therapy, and then start to talk about how do we get them back to where they want to be, because we have multiple options to restore control. For the man that has mild leakage, let's say it's in the setting of radical prostatectomy. So now there's no more prostate. If he's only using 1 to 2 pads a day, especially if he's never had radiation, he might be a good candidate for a sling, which would involve an outpatient procedure whereby we place a hammock to elevate the tube that drains the bladder, again, the urethra, to give him more control. If the leakage is more severe, we have something that's even more sophisticated than the sling, and this involves a cuff that's placed around the urethra, similar to a blood pressure cuff, though much smaller, and instead of filling with air like a blood pressure cuff, it fills with saline or salt water. So it's wrapped around this tube, it's connected to a pressure regulating balloon that's placed elsewhere, and then it's also connected to an olive-shaped structure hidden below the skin and soft tissue of the scrotum. So now, when a man wants to urinate, he can simply press to displace the fluid that's keeping his urethra pressed closed, such that this tube opens, or this cuff opens, and he can empty his bladder comfortably. And then it closes back on its own, so that he can walk around with the confidence that he has restored bladder control. This is typically covered by insurance. It's typically an outpatient procedure with excellent satisfaction and excellent long-term outcomes. So if you're interested in having this condition addressed, feel free to come in and see us and we'll be able to go over this in more detail.